Stark State College Massage Therapy Lab Notes with Michael Vahila, licensed acupuncturist and licensed massage therapist. So when we talk about vibration, this is a lateral movement back and forth. It isn't down into the tissue, it's back and forth. So you place your hand in such a way where the hand will not slip on the skin and you go rapidly back and forth. Now, Kellogg uses the term lateral vibration, but lateral vibration is what you always do in vibration, so it's a little redundant that he says lateral vibration. Vibration is this effect. But he describes that first as lateral vibration. He says do it at 6 to 10 repetitions per second, as rapidly as you can. And then in vibration, there are several variations on that basic technique. One of them is knuckle vibration, where you take the fist and you're doing this lateral movement, but simultaneously you are gliding across the skin. So this is the lateral vibration part of it being done with the knuckles. And notice I'm not sliding. Once the hand is fixed in position, you go back and forth rapidly. Simultaneously with knuckle vibration, you move across the surface as well. There are two forms of vibration that move across the surface of the skin. One of them is knuckle. The other is superficial vibration. So it's the same thing. Superficial vibration starts out looking like lateral vibration. The reason it's superficial is you can't use quite as much pressure because you're going to be moving across the skin simultaneously. So with vibration, you can apply a fair amount of downward force if you're just staying in one position. But if you have to move, he calls it superficial vibration, because as you vibrate, you simultaneously move across the surface. Deep vibration says to use either the heel or the fist. This is good to do in the glutes, for example, where there's more musculature. In the Kellogg text, he says use it on the abdomen as well. It might be a little uncomfortable for some people, but certainly over the hip area. And he also says to keep the arm straight, and this is actually done more from the arm. And the purpose is to get the force deeper into the tissue. So you can use more pressure, whether you're using your fist or the heel of your hand. Then digital vibration. As with digital kneading, you're using the fingertips, and you would do this in smaller bony areas like along the spine or around a joint. So if we're doing it along the spine, the technique of shaking in the Kellogg text, he also puts in the category of vibration. And so with shaking, this is done on the limbs, where you gently hold on the arm at the wrist. You do want to apply some traction. It's not just loose and you shake, but you need a combination of traction and then a rapid shaking motion. As I said, this helps to confuse the proprioceptors in the shoulder and the arm so that the tissue relaxes. If you were to do that on the leg, it would be a similar technique where you would simply traction and shake. And as odd as it may seem, Kellogg even does that on the head and neck, tractioning the head and shaking. The special effect of vibration is stimulation. Vibration is contraindicated where there is hyperesthesia, acute inflammation, fever, morbid growths, or suppuration. Vibration is frequently used and useful for paresis and paralysis, neuralgia, neurasthenia, and most functional nerve disorders. It's also useful for relieving coldness of the extremities arising from spasm of the small vessels due to vasomotor disturbance, numbness, tingling, and various other morbid sensations.